Wardlow, and I am a licensed independent social worker here at Waverly Health Center. My role is to provide psychotherapy. In simple terms, that means I help people look at emotions, thinking patterns, and even past trauma that might be impacting their daily mood, daily functioning.
I'm Dr. Ann Rothy. I'm a psychiatrist at Waverly Health Center. A psychiatrist is a medical doctor that specializes in treating illnesses that affect the brain and then affect behavior, thinking, perceptions, things like anxiety, depression, memory trouble.
Unlike psychiatric providers, I don't prescribe medication. My focus is purely therapy. That means sitting down with people, helping them identifying patterns, their thoughts, behaviors, giving them tools to cope in a healthier way.
My role is different in that because I'm a physician, I look at things from a medical stance. I take a holistic approach when I'm interviewing patients. I'm wanting to make sure that any medical problems the person has are well managed, or if they have a new medical problem that's not yet been diagnosed, I'm working with their primary care provider or their specialist to make sure that that is under control. And so I'm looking at all these different areas, and I'm also ordering lab tests, sometimes neuroimaging, like a head CT or a brain MRI, to make sure that something neurologic isn't going on. I'm ruling out or ruling in all sorts of problems. And so that's a much different approach than a counselor is going to take. There's stigma around mental health conditions. There's stigma around being a psychiatrist. There's stigma about not feeling normal, whatever that is. And I think anything we can do to educate patients, to give them references that are reliable and evidence-based and will give them good information is a way we can be helpful.
Therapy is a place to learn practical skills, things like communicating better, managing stress, setting healthier boundaries. Even people who describe themselves as generally doing fine can benefit from having a place to reflect, process, and grow.
Even though we have many more ways to connect with each other as people, we are less connected than ever. And so I think that coming to see me, talking to my nurse, talking to one of our therapists is a place that people feel like they can just be who they are without strings, right? Or without judgment. And that's priceless.